And this week's Health Aware, our Adriana Gonzalez Chavez spoke to a local heart specialist about the difficulties members of the Black community may face finding proper heart care.
Heart disease is the #1 killer in the U.S., and the risk is even higher in the Black community, reports the American Heart Association.
There are multiple factors that increase the risk for heart diseases or cardiovascular diseases among people in general, and these would include hypertension, diabetes, high cholesterol, smoking, and of course genetic factors. More particularly, as we're talking about the Black History Month, it's important to emphasize the fact that hypertension is pretty prevalent among the African Americans.
While diet and lack of physical activity can lead to heart disease, so can genetics and family history, says Dr. Ibu Inakpene with the Midland Memorial Hospital.
And one of the known factors has been attributed to a genetic variant in the metabolism of salt among the Blacks, and that increases the risk for high blood pressure and thereby increasing the risk for more cardiovascular diseases. Even there's also some genetic variants in the metabolism of glucose that increases the risk of diabetes. But unfortunately, there's also a higher prevalence of lower socioeconomic status and some health disparities among the Blacks and even some minorities, and that also increases the risk.
Cuisine in the African American community is often high in fat and in cholesterol, but Dr. Inakpene says some tools may help keep people on track, such as having high blood pressure cuffs at home that can be inexpensive. Even in young people, heart disease can be a risk.
A lot of young people are coming down with heart attacks, strokes, and even end-stage renal disease requiring hemodialysis. The emphasis really should be prevention.
Dr. Inakpene encourages everyone, and especially the Black community, to look for free tools that can help them manage their health.
Part of the purpose of this is to encourage people to know that there's a lot of information out there. American Heart Association, even Midland Health, as we're here, there's a lot of community effort, a lot of community resources available that people can reach out to on the Midland Health website.
Dr. Inakpene is also happy to honor Black Health Month every day through her work.
I feel very privileged to be a Black physician who happens to be a woman and who happens to be a cardiologist.
And be sure to tune in every Monday for an all-new Health Aware.